Good evening, friends. We are live on YouTube today to discuss the 10 very important questions from dental materials going forward. Going forward means for your upcoming next year's NEET examination, all right? And of course, your INI examinations, right, friends? Since this is a live session, first of all, let me ask you, hope all of you are doing well. We are live on YouTube. You are free to post your queries also in the chat box provided by the software, the YouTube software. As far as today's session is concerned, friends, this is going to be a very interesting one. The topics that I have, shortlisted, the questions, the very specific questions that we are going to discuss, they are encompassing overlapping concepts. So the idea is that while we are discussing those 10 questions, effectively you're able to solve at least 30 to 40 questions. That's the perspective with which we have chosen these questions, friends, right? And obviously we've tried to encompass, the entire, more or less the entire range of your entire curriculum of dental materials. Obviously, it's not possible. For that, you will have to subscribe to and obviously register for DBMCI, which is the best coaching institute for your MDS entrance examinations as of now, friends. So if you want a detailed, discussions and detailed mentorship and teaching and content, you will have to be with us, right? We will handhold you and provide you with the best possible coaching that is there, right? As of now, yes, these 10 questions, I promise you, they will be extremely helpful, both from information point of view as well as concept building point of view, right, friends? So without wasting much time, the idea is to finish this session in about 35, 40, 45 minutes so that we retain your attentiveness and interest in this session, right, friends? So let's go about it. Let's go forward. All right. So the first question that we'll be discussing here is, which of the following statements is correct based on the image? Now, this question, many people got this wrong, friends. Primarily because, they got slightly confused. It was not a linear question in the sense that they were not asking just one specific concept, right? This question came in AIMS about a couple of years back. And unfortunately, the interesting part is this same diagram, exactly the same diagram is given in your latest Phillips, right? So if those students who were studying diligently their standard textbooks, following the concepts, having their, focus completely on their target, that's the aim of securing a good MDS rank and getting a seat of their choice, only they were the ones who would attempt this question correctly. Otherwise, there was a lot of hodgepodge, overlapping, confusion in the concepts. The question per se, if you understand each and every concept individually, it's actually very simple. So let us just see what exactly is this guy trying to ask us. There are three dental materials, right? Irrespective, whatever they are. They might be an elastomer, they might be a cobalt, chromium, alloy, it might be a ceramic, it might be amalgam, whatever. Irrespective. Material A, material B, material C, right? They have given you a stress strain graph, right? And within that, they're primarily asking you about the percentage elongation or brittleness or the ability of the material to undergo plastic deformation. That's number one. Number 2 point that they're asking is, can the participant, can the student understand the strength value, ultimate tensile strength value, seeing the graph? That's it. And yes, of course, the slope of the graph, which gives you the ratio of stress upon strain, which is the modulus of elasticity, which is nothing but a measure of stiffness or rigidity. Simple enough. So let us try to deconstruct this and see these concepts first, understand them, and then try to compare material A, B, and C with each other, right? Do not see the options first. The examiner is there to confuse you. First, reach your conclusion in such questions and then try to fit your conclusions with the options that are given. Simple approach. If you immediately see the options, you'll get confused, right? So let us try to deconstruct this and let us see how we go about this, right? So I am drawing a simple stress versus strain curve, my friends. Now, obviously, I'm not going to go into the definitions of stress and strain. We've done this in our live class, right? Now, as I go from the origin, the straight line portion, right? Where the straight line portion ends, that's my proportional limit, right? And then my curved portion starts. That is where that signifies that the material is starting to undergo plastic deformation, right? So if the material finally fractures here, that would be the ultimate strength value of the material. So we'll just plot this. We'll make a 90-degree plot on the stress curve, and that would be the UTS. If I'm talking of the ultimate tensile strength, then it would be UTS. If I'm talking of the compressive strength, it would be UCS. If I'm talking of flexural strength, it would be UFS, irrespective. Here, the question, the examiner itself is saying that UTS refers to ultimate tensile strength. PL refers to the proportional limit. So that's simple. That makes my life easier, right? So we're talking of tensile strength, right? Now, from the point of proportional limit, the irreversible deformation, irreversible strain that is taking place is the plastic deformation, right? So here, the plastic deformation of this particular material is how much? Is this much. That's my plastic deformation, right? Now compare this, and obviously, yeah, we have the proportional limit here, right, friends? Simple. So we have a measure of ductility, that is the ability of the material to undergo plastic deformation along a tensile stress, along the long axis of the material, right? We have a measure of ultimate strength, that is when the material will ultimately fracture or break or give way. Now compare this material with an extremely brittle material, that is a material which does not undergo any plastic deformation, right? So let's see. That material's graph would be somewhat like, this is the stress on the y-axis, the strain on the x-axis, and this is a material at the proportional limit, the material fractures. That means the proportional limit and the ultimate tensile strength value coincides. So that's your PL for a perfectly brittle material like a ceramic. It practically undergoes zero plastic deformation. Perfectly brittle material, zero plastic deformation. So PL, that's a proportional limit, and the ultimate tensile strength values will coincide. If I'm to draw this plastic deformation, try to see, plastic deformation is zero. So irreversible deformation or irreversible strain is zero. This is a perfectly brittle material, right? What is the ultimate tensile strength? Obviously, when I'm comparing two materials on the same graph, I can compare the ultimate tensile strength between the two. Now let us go back to the question, right? So we know the concept. Now we'll go back to the question and try to understand A, B, and C. As you can see, friends, here, material A has an ultimate tensile strength value which is more than that of B and C. That's number 1 point. So material A has got strength value of A is more than that of B, which is more than that of C. That's number 1. What about the plastic deformation potential? The plastic deformation of material A is how much? This much. That of B is only this much, and that of C is 0. Right? So C is most brittle, B is less brittle, A is least brittle. If I talk about stiffness, that's the slope of the stress strain graph. The stiffness of A is more than that of B, which is more than that of C. These are the facts that I know without looking at the options. Now let us look at the options. Now the examiner cannot confuse me. All right. So A is more, the first option says A is more brittle than B. Is A more brittle than B? No, because A is undergoing more plastic deformation, so it is less brittle. The option is wrong. I don't have to look at the other part. Let us look at option B. A is more plastic than B. Yes, it is, because it is undergoing more plastic deformation and has more strength. That's true. So B is one correct option. Obviously, this is a simple question wherein more than one correct options are not given, right? So B is the correct answer here. That's number one. All right, my dear friends. Obviously, let us look at the other options as well, since this is a discussion and this question can come as part of, in INI examination as part of multiple correct answers. B is more rigid than A. What is rigidity? Stiffness, right? Measure of rigidity, measure of stiffness, Young's modulus, modulus of elasticity. Practically, more or less, all of them are synonymous with each other. That's false. Why? Because the slope of B is less than that of A. In other words, B is less rigid, less stiff, has got less Young's modulus of elasticity than A. So that's again a false statement. B is less rigid than A. That's true. But what about the other part? And has more plastic deformation potential. That's false. We've just seen that the plastic deformation of A is more than that of B. Right, friends? So approaching such questions, don't let the examiner confuse you. See the question first, understand the graph, write it down in your rough sheet of paper or make a note in your head, and then approach the options. Right, friends? So this solves a lot of, overlapping MCQs. I hope that's clear. Next important question, and a source of a lot of heartburn to all of us: porosity. When we're doing casting alloys, porosity due to gas inclusion during rapid solidification of molten alloy is, again, the moment you see porosity, make a mental note of the classification of porosity first. Right? See, when during the examination, you're attempting those 240 questions, your mind is oscillating from anatomy to biochem to conservative to oral surgery to oral pathology. So you need to give yourself some time to warm up to that question, to be in that zone, to be in that world of that question. Otherwise, it's all confusion. You see the options, the examiner takes you on another tour of the world, right? And you end up marking the wrong answer. So you see the option, see the question, porosity due to gas inclusion during rapid solidification. Immediately you won't realize the answer. Make a mental note of what are the different types of porosities. So let's do that. Right? Porosity, primarily classified two types. One is due to solidification defects. And I'm telling you, friends, there is one very simple question from porosity that comes that's related to localized shrinkage porosity. Put a sprue channel, make a transverse bar. If I do that, or the thickness of the sprue should be at least equal to or greater than the maximum cross section of your wax pattern. This will help in preventing localized shrinkage porosity. But the moment the examiner asks you about porosity of other types apart from localized shrinkage, you're all confused, and it's not your fault. You know why? Because all of them are very overlapping, right? So it's not your fault. The point is, you need to stress on the correct, you have to take your time, slightly take your time, take 2-3 minutes extra. We're not solving physics and maths problems here. This is all biology. Time is never scarce in any biology exam. You understand, whether it's your PMT, whether it's your PG entrance, take your time. Take your time. So solidification, porosity primarily due to solidification defects, right? This is known as time management. Yesterday, what happened with Alcaraz? Match management. He's playing great, but he spent all his energy in the first two sets, cramping all the way, and that's how Djokovic played that game of tiring his legs out, isn't it? So take your time. Stay relaxed during the examination. Back yourself. Have faith that you know it. Slowly, you'll start recollecting things which you've revised 6 to 7 times. I always say revise all these MCQs, important MCQs, at least 6 to 7 times, right? The solidification defects and due to trapped gases. Solidification defects, we have localized shrinkage, which most of you do not make a mistake in, right? Then we have microporosity. This you will have to memorize. Examiner is going to confuse you. And obviously you have suck back, which is another sort of a variation of localized shrinkage porosity only. Now microporosity, just memorize this. This is due to rapid solidification in which the microvoids do not get the time to segregate in the liquid pool. Memorize this. Microporosity due to rapid solidification, due to which the microvoids do not get the time to segregate in the liquid pool. Why am I laying so much stress is, I'll tell you in a while. First of all, memorize this line. Then I'll tell you where the examiner is going to confuse you. Trapped gases. Trapped gases, again, 3 or 4 types. What are they? Pinhole porosity, gas inclusion porosity, subsurface porosity, and back pressure. Again, back pressure porosity, nobody makes a mistake. Everyone remembers that for a gypsum bonded investment, at least 6 mm of gap should be there at the end, between the end of the wax pattern and the end of the casting ring, right? Now, pinhole and gas inclusion porosity is due to trapped gases, again due to trapped gases, but again due to very rapid solidification. These trapped gases are not able to, during the molten state, these silver and copper, there's some certain elements in the alloys which have this tendency to absorb oxygen from the surrounding air, right? And when during solidification, these gases, these trapped gases, they leave, right? They are released. That causes porosity. Now that is, if the size of those voids is very small, then it's pinhole. If the size is big, it's gas inclusion. Now the good part about this question is both pinhole and gas inclusion were not given in the option. But the confusing part was, see the question again. Porosity due to gas inclusion during rapid solidification of molten alloy. See friends, rapid solidification. Now rapid solidification is also a cause of microporosity. But that is when microvoids do not get the time to segregate in the liquid pool. That is why I told you to memorize this word. But when there is rapid solidification, and due to that, the gases that were included, right, some of them are able to escape, some of them are not able to escape, they escape at a later time. That causes porosity due to trapped gases, which is of 2 types. That is pinhole and gas inclusion. Now gas inclusion was not given here in the option. So our answer is pinhole, right? That is why our answer here is pinhole porosity, my dear friends. That is why the very important question, and so many of us mark this, we just completely lost. We know back pressure, we know localized shrinkage, some of us know suck back. Apart from that, microporosity, gas inclusion, pinhole, we don't have any idea. And frankly, it's not our fault. It's something that we're not exposed to practically in our undergraduate days. something we just try to memorize to pass our examinations. Well, I've tried to help you in simplifying that process of, understanding and memorizing this, right? So the correct answer here is pinhole. Next very important question, and again a very, very controversial question. I have been having this discussion over the past 2 days with my students. Highest slope in the stress strain graph is seen in ceramics, enamel, gold crown, elastomers. Now, first of all, elastomer, absolutely not rigid. So that would be having the lowest slope. The stress strain graph would be absolutely flattish for elastomers. That completely is eliminated. Now the fight is between ceramics, enamel and gold crown. See, if you talk about conventional ceramics, something like those ceramics which are used to make, say, normal glass cups, normal ceramic cups, right? They don't have much modulus of elasticity, about 60 gigapascal. So from that perspective, or conventional old-time porcelains, from that perspective, the modulus of elasticity of enamel is pretty high. It's about 84, 85 gigapascal. And that of conventional ceramic is only about 60, 50, 40 gigapascal. In fact, if you talk about gold crown, depending on whether we are talking about type 1, 2, 3 or 4, the modulus of elasticity of gold crown is also somewhere in the range of 50 to 100. Right? Now the controversy. What should we mark? Whether we should mark enamel, whether we should mark ceramic, and some people would say gold crown. See, when the examiner is giving you the option of ceramics, he's also trying to elicit whether you are aware of the properties of, modern aluminous all ceramic kind of crowns. The material that is made of aluminous, glass infiltrated ceramics, they are extremely stiff. That means their modulus of elasticity is almost to the tune of 350 to 400 gigapascal, way much higher than that of enamel and gold. Therefore, the correct answer is ceramics. I'll write this down. This is absolutely categorical. I mean, there should be no confusion here. So when we talk about the stiffness, and we compare the stiffness. That means we compare the modulus of elasticity. In other words, the Young's modulus between ceramic, enamel, and you can say gold, right? Then we have to incorporate the values of modern day aluminous porcelains, the values of which can be as high as 350 to 400 gigapascal, which is much more than that of enamel, which is about 84, and gold, depending on we're talking of what type 1, 2, 3, 4, it would be anywhere between 50 to 100 gigapascal. So the answer is ceramic. Normally ceramics are representative of the different types of ceramics and porcelains. Not factually correct, but yes, that is how the examiner is trying to elicit our knowledge, right? So I hope there is no confusion here as far as this question is concerned. All right, then the next question, which of the following is not a method to speed up the rate of reaction of a gypsum product? So what are the ways? So the moment you see this question, orient yourself to the chapter of gypsum products. Your mind is everywhere, right? Between anatomy, physiology, everywhere, right? You need to first of all get a tubular vision now. Gypsum products, okay, what is gypsum products? Calcium sulfate hemihydrate, okay, we mix it with water. Then what happens? Calcium sulfate dihydrate forms, okay, fine. So what are the variables there? We talk about setting expansion, we talk about setting time, we talk about mixing time, and so on and so forth. That is the zone that you are trying to warm up into, right? In the initial 20-30 seconds when you see the question. Now, without looking at the options, Just see, he's trying to ask you the ways of speeding up the rate of reaction. That is, he's trying to ask you about the setting time. So what are the various variables that affect the setting time, right? First, the speed of dissolution of the hemihydrate into water. If I accelerate that, the dihydrate crystals would precipitate out faster, setting time decreases. So basically the speed of reaction increases. What is the other? The number of the nuclei density, that is the number of nuclei of crystallization, that is calcium ions and sulfate ions within a given unit volume. If there are more, the nuclear density is more, they are more closely spaced with each other, the growth interaction is faster, right? And the dihydrate crystals precipitate out faster. So speed of the reaction increases, setting time decreases. What about the third variable? The rate of crystallization, right? So if the crystal growth. So if the crystal growth is faster, again, the setting time decreases, the reaction speeds up. Now let us look at the options. The first option is solubility of hemihydrate. Again, if it increases, then the setting time decreases, speed of the reaction is fast. Number of nuclei of crystallization, if they increase, again, nuclear density increases, setting time is slower, setting time is less, means the speed is fast. So again, that is also not an option, right? He's trying to ask us not a method to speed up the reaction. Increased rate of crystal growth. Again, crystal growth is faster, setting time is less, speed of the reaction is fast. Decreased rate of crystal growth. And now this is the answer of exclusion. Decreased rate of crystal growth implies that my dihydrate takes more time to precipitate out of the solution. That means setting time increases, speed of the reaction decreases. So this is not a method to speed up my reaction. This is a method to lower the setting speed, right? So answer D is the correct answer for question number 4, right friends? This is the approach. You have to warm up into the topic to get your head in that chapter, right? Just get oriented. What all is there? What were the things that used to confuse me? Try to reconcile. Try to fix things in your head first, then see the options, right? All right. If gypsum mixing is done with boiling water, again, a very controversial and people just forget about this. If gypsum mixing is done with boiling water, what happens to the reaction? Again, the effect. What is the topic? The effect of temperature on the setting speed or the setting reaction of hemihydrate with water, leading to the formation of dihydrate. Now, friends, please memorize this. Except for gypsum products, any reaction in the entire world of dental materials, you heat up, you increase the temperature, the reaction is faster, right? The reaction basically moves fast from the left hand side to the right hand side. However, there's a problem with gypsum products, right? If you increase the temperature till 50 degrees Celsius, there is more or less no change. The reaction rate is more or less the same. Between 50 to 100 degrees Celsius, the reaction rate, instead of being accelerated, it is decelerated. Now, what is the reason? See, for the reason, we need to understand first of all, the most widely accepted theory of setting mechanism of hemihydrate with water. What is that? Dissolution precipitation theory. Meaning, the hemihydrate crystals dissolve in water and simultaneously dihydrate crystals start to precipitate out immediately. Why? Because the solubility of dihydrate, I again repeat, the solubility of dihydrate is 4 times less than the solubility of hemihydrate in water. In other words, the solubility of hemihydrate is 4 times more than the solubility of dihydrate in water. Now, what happens is that when you increase the temperature from 50 to 100 degrees Celsius, the difference between the solubility, which was till 50 degrees Celsius 4 times, the difference between the solubility decreases. So the driving force of the reaction from the LHS, from the left hand side to the right hand side, is decreased. So the reaction rate is decelerated. and at 100 degrees Celsius, no reaction takes place. Why? Because the solubility of hemihydrate in water is the same as that of dihydrate in water at 100 degrees Celsius, right? So at 100 degrees Celsius, that is the boiling point of water, no reaction takes place. And for your image-based question, which can come, see the graph given in Phillips. Let us understand this. This is the graph given in Phillips. Just see at 100 degrees Celsius what is happening. 100 degrees Celsius. See, hemihydrate, that is this, and gypsum, that is dihydrate. See, at 100 degrees Celsius, their solubilities are more or less the same. That is just short of 0.2. When their solubilities are the same, there is no difference in solubility. Where would the reaction go? It will stay there. No reaction will take place. Because hemihydrate will not be converted to dihydrate. They are both equally soluble in water. Right? Great. This brings us to the next question, friends. Yes, very important topic and often ignored topic by all of us. That is finishing and polishing of dental materials. Clogging of an abrasive wheel with debris causes reduction of abrasive action, and this is known as what? Clogging of an abrasive wheel. Okay, let us imagine I have done a composite restoration, right? And I'm using some kind of finishing and polishing material based on, say, diamond particles. It can be a Soflex or a Super Snap disc. It can be a finishing burr. What happens after some time? The pores in the diamond in between the diamond particles, they get clogged with debris. When they get clogged with debris, cutting is practically not there. Only heat generation is there. Also, some amount of, when I keep on pressing it, heat is being generated. Some amount of eccentricity in the burr and the finishing and polishing material would come. It would not rotate uniformly along its central axis, which is known as lack of run out and eccentricity, right? We discussed this in operative armamentarium. So what do? There are two concepts here: proving and dressing. Proving and dressing. So imagine I have this finishing material, right? This is my finishing stone. Green stone, blue stone, whatever colored, whatever is the size of the diamond particles or abrasive, whatever. It's silicon carbide based, Arkansas stone, diamond, irrespective. I'm not talking about that. I'm saying that this is an abrasive material used for finishing and polishing, right? I'm using it with a heavy hand at low speeds. Normally finishing and polishing is done at low speeds. So this burr would become eccentric after a certain point of time. How do I maintain its correct shape so that it again rotates along uniformly in symmetrical fashion along its central axis? I rub it against a substrate which is harder than this. So if this is, say, a silicon carbide finishing stone, I rub it against a slab of diamond, right? And I try to, get a uniformity in its rotation motion so that there is no run out and eccentricity. That process is known as truing. Right, friends? Second important thing. What if I want to convert this material, this stone, into a flame-shaped one, right? Into a, say, a flame-shaped one or some other shape, right? So again, I use a similar slab of a harder material like diamond and try to abrade this material to a uniform shape. That process is known as dressing. That's another MCQ. Dressing does another thing. During finishing and polishing, when the pores between the diamond particles get clogged by debris, dressing removes that debris. So dressing does two things. It changes the shape towards the desired shape, and it also declogs. It also removes the clogged debris from the material. The process of the material, the rubber, the stone, the finishing instrument or the burr or the wheel, the process of it getting clogged with debris is known as blinding. That is what the MCQ is about, and these are the related concepts and potential MCQs. Truing and dressing. If you remember truing and dressing, obviously you will remember blinding, friends. Blinding is the easier concept to remember. The abrasive particles of, say, diamond or silicon carbide, whatever this stone is made of, when they get clogged by debris of the material that they are cutting, that process would decrease the efficiency of this burr or stone for further use. That is known as blinding. And to remove these debris, it has to be rubbed against a harder substance so that it gets declogged. Right? That process is known as dressing. And truing is to ensure that this material remains symmetrical in its rotational motion. So truing, dressing, and of course blinding are the concepts that we need to know. So the MCQ, the answer is simple here. Clogging of an abrasive wheel with debris causing reduction of abrasive action is simple, blinding. The examiner has also put truing and dressing to confuse you, because whenever you read your Phillips, truing, dressing, blinding are mentioned together. That is why I again reiterate, see the question, try to get the answer in your head first and then match it with the options. Otherwise, the examiner is going to take you for a ride and force you to do a negative mark. Right? Advantage of zinc phosphate over GIC. Friends, advantage of zinc phosphate over GIC, for this we need to see the master table given in Phillips. 3 or 4 MCQs come from here. When we see the chapter of dental cements, there are no shortcuts. See this, zinc phosphate. What is the elastic modulus of zinc phosphate, friends? 13.5 gigapascal. And what is the elastic modulus of glass ionomer? It is 7.3. So the modulus of elasticity of zinc phosphate is almost double that of glass ionomer. And that is why, friends, all of you have been taught in your second year undergraduates, in your preclinical and in your clinicals in third year and final year, to give a zinc phosphate base when you do an amalgam restoration, which is considered better than a GIC base. You can give a GIC base, but when you're doing your amalgam restoration, because amalgam and direct filling gold, you have to put slightly high amount of forces to pack them inside the cavity. You don't want your base to deform. So you want your base to have a higher value of modulus of elasticity or stiffness, so that it doesn't get deformed. Right? That is why zinc phosphate is the base of choice when you're doing your basing of amalgam restoration. Right? 13.5 gigapascal is its value, and 7.3 gigapascal is the value of glass ionomers, modulus of elasticity. The very important table. Back in college, our seniors and teachers used to call this the master table in Phillips. So please go through this. Right, friends? Excellent. Very important question. Let us see the next question, friends. Which of the following does not occur in high copper amalgam? Electrochemical corrosion, chemical corrosion, penetrating corrosion, or corrosion does not occur at all? First of all, please understand this. Corrosion and corrosion products of the similar type do form in high copper amalgam as well. Just like in low copper amalgam. It's just that it takes a longer period of time. If in a low copper amalgam, corrosion products and corrosion starts to take place by 6 months of doing the restoration, in a high copper amalgam, corrosion takes place after 1.5 to 2 years. But similar kind of corrosion products, tin chloride, tin oxychloride, are formed in high copper amalgam as well. So first of all, what kind of corrosion does not occur in high copper amalgam? The first thing that should come to mind is, what is that culprit which was causing such detrimental corrosion in low copper amalgams. That was the gamma 2 phase. And what is the gamma 2 phase? Let us see here. This is your classic low copper amalgam setting reaction or amalgamation reaction. You have, friends, you have the silver tin alloy here, right? You mix it with mercury. As soon as the two get mixed, mercury attacks the powder particles of your amalgam alloy. Now, based on the difference in solubility between silver and tin, right? As soon as the mercury attacks the amalgam alloy powder particles, silver and tin enter the solution. But the solubility of silver is less than that of tin. So, the silver mercury phase, that's our gamma 1 phase, precipitates out first, and the gamma 2 phase precipitates out later. Well, that is a separate MCQ. Here, what is important to realize here is see the difference between the crystal structure of gamma 1, which is equiaxed, versus the gamma 2, which is long blade like. The orange particles that you see here, the orange crystals that you see here are the gamma 2, and the light blue ones are gamma 1. So you can see here gamma 1 are equiaxed, whereas gamma 2 crystals are elongated blade like, right? And they are the ones which form in low copper amalgams. In high copper amalgams, gamma 2 phase does not form, or if it forms in very less amount, or if it forms, it is formed due to operator or lab technician mistake. Why? Because if you're not mixing the correct proportion of amalgam alloy with mercury, then gamma 2 phase forms in high copper amalgams. Usually, routinely, if you're following your standard operating procedures, it does not form or forms in very less amount. Now, the biggest problem with the gamma 2 phase is twofold. One, the electrode potential of tin is very less. That means it is more prone to corrosion. In other words, it is more stable in its oxide and oxychloride form. So it would immediately getting in contact with oxygen and chloride in the saliva, it would leave its gamma 2 phase, that's tin mercury phase, and would enter into a chemical reaction with oxygen and chlorine and would leave. So a void would be formed here. Now the thing is, why is it that corrosion due to the gamma 2 phase is known as penetrating corrosion? Simply because of the morphology of the blade-like crystals of gamma 2. These are very long, elongated, move from the surface of the amalgam to deeper parts of the inner parts of the restoration, the bulk of the restoration, right? Now, when tin is lost to the environment in the form of its corrosion products, these voids are left behind and they penetrate from the surface to deeper parts attributed to the specific blade-like elongated morphology of the gamma 2 particles. And that is why the corrosion in morphologically, the corrosion in low copper amalgams is known as penetrating corrosion, and because gamma 2 phase is not present in high copper amalgams, penetrating corrosion is not seen in high copper amalgams. Simple, right? That's the answer, friends. So let us see the options again. Which of the following does not occur in high copper amalgam? It is penetrating corrosion. It does not occur in high copper amalgams if you have been judicious enough in mixing the amalgam alloy and mercury in the correct proportion and ensuring that very minimal or no gamma 2 phase is formed. So penetrating corrosion is not formed, right? Amalgam achieves, next important question, amalgam achieves 70% of its strength by. So it is asking you in hours. Now, the values here are very important, 2 or 3 important values, friends. We'll discuss that. See, you do an amalgam restoration, you can relieve the patient, you do a cavity prep, say if it's a simple class 1 buccal pit, you do a cavity prep, insert the amalgam and relieve the patient by about 20 minutes. And the problem is that the amalgam develops its compressive strength over a period of time. It does not attain its final high compressive strength value within minutes. So, That is where ADA specification number 1 lays out certain rules. It says, number 1, that the final compressive strength of any amalgam should be at least 310 megapascal. That's your number 1 MCQ. The compressive strength of any amalgam, and mind you, any means even if you're using a low copper admixed amalgam, or you're using a high copper admixed, or you're using a high copper unicomposition spherical amalgam, the minimum should be 310 megapascal. And when we say that this is the compressive strength of the amalgam, it is usually measured at 1 week. Right? That is one important value that we need to memorize. ADA specification number 1, you all know, that is another MCQ, that amalgams fall under the purview of ADA specification number 1. Next important point, after 1 hour, the minimum compressive strength of amalgam should be at least 80 megapascal. That's another very important MCQ. After 1 hour, the minimum compressive strength of any amalgam restoration should be at least 80 megapascal. That's another important MCQ. After 8 hours, usually amalgams achieve about 70% of their final compressive strength value. So if I'm talking about the minimal, then it would be 70% of 310. Isn't it? That would be somewhere around 310 multiplied by 7 would be about 217, right? So after 8 hours, usually it is seen that amalgams achieve 70% of their final compressive strength value, which basically implies that when you do an amalgam filling, to simplify things, what do we say in the OPD? 24 hours tak kuch mat khana. Is taraf se hard kuch mat khana, isn't it? We tell the patient that till 24 hours, do not eat anything very hard from this side. To be more specific, tell the patient that for the next 8 hours, if you really want to be very specific and true to the book. Because after about 8 hours, 70% of the final compressive strength is achieved, and the patient can have moderately hard food after 8 hours of doing an amalgam restoration. So this is the question that was there in the MCQ here. Very important MCQ, can come again, that amalgam achieves 70% of the strength by 8 hours. Next, and the last question, the 10th question, the function of 2% potassium sulfate in gypsum product. Now friends, this is talking about accelerators and retarders. So we'll just have very briefly, accelerators greater than 2% of potassium sulfate is the most common accelerator. What is the other accelerator? Other accelerator is around 3.4% of sodium sulfate. That's another accelerator. Then around 2%, 2 to 3% of sodium chloride is another accelerator. When we talk about retarders, then a simple mnemonic is ABC: acetates, borates, and citrates. Anyways, what is the answer here? The function of 2% potassium sulfate is B. First option is regulate the setting expansion. Second option is regulate setting time. Third is acts as retarder. And D is none. Of course, it regulates the setting time in the sense that it acts as an accelerator. So it decreases the setting time or accelerates the reaction. Right, friends? So this was about the 10 questions that we are supposed to discuss today. I hope they have added value to your preparation. My entire aim was to tell you the approach of solving MCQs in general. To be more specific with dental materials, I always choose those questions in which I'm able to tell you at least 3, 4, 5 points extra so that your time utilization is done in the best possible way. Wish you all the very best. Stay motivated, stay energetic, and stay positive. You have to keep working hard. There are no shortcuts, friends. And just that you have to keep your approach and your spirits high. I wish you all the very best. Until we meet next time. Thank you.